Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, the pain from spinal stenosis can throw you for a loop. We'll offer straight talk on treatment. Then, what's in a name? When it comes to your financial planner, plenty. Find out what those fancy titles truly entail. How has Obamacare impacted our insurance? Get our update on the Affordable Care Act. Plus, let's see if the suggested servings for your diabetes diet will serve you well as you age. And little-known tips to avoid taxes on your IRA and 401k.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Oh, the backbone is connected to the leg bone, or at least it seems that way if you have spinal stenosis. How can you get your back and your legs to straighten up? Dr. Abud is here to make the connection for us. Dr. Abud is with the Solon Spine and Wellness Center. Welcome.
Thank you.
Okay, so this disease or illness or condition is called spinal stenosis. So how come that spine, how does it affect the legs?
You know, one of the most common health complaints that we see in people in their 60s, 70s, and 80s is back pain. You know, and I think to some degree back pain is normal, but the back pain we're describing today, stenosis, the way that you see the typical person with stenosis is they're leaning forward, they're bent and they're hunched forward, and you'll pick them out in the grocery store, at Home Depot, they're leaning on the cart, and they shuffle with their feet, and they feel like when you talk to them, they'll say, my legs just feel tired or heavy and I need to sit down. And then it will go into their back as well. And so it's miserable because it's a slow onset typically. You know, it's not like it'll be over a year or two, they'll just continue to get worse and worse, and then their activity levels just basically stop.
Yeah, and that's a shame. So is this something that occurs more frequently as we age?
It does, and everybody to some degree has degeneration in their spine, but these people with stenosis, it might have been maybe from an injury 10, 15, 20 years ago, it might have been from poor posture or excessive weight, or whatever it is, caused that disc or that cartilage that sits in between the vertebrae to decay or to eat away.
Ooh. Is there a test to know for sure that's what it is?
Typically, by the time the patient has come into my office, they've already had an MRI, they've already had an X-ray, and that's definitive, and that will show us the condition of their spine.
Okay, so what is the normal treatment for this spinal stenosis?
When you go to your doctors, they'll usually use anti-inflammatory drugs or physical therapy or something to strengthen it or pain management. But what's so exciting to me is the new research called non-surgical lumbar decompression.
Okay, is that something your office would tell us what that's like?
It is, and that's kind of what our office specializes in. It's a specialized table that stretches the spine. It creates like it's called a negative intradiscal pressure. It draws blood into the disc.
Oh, here we have a illustration.
Right, and you can see how the disc raises to some degree. If we can get fluid into that disc, blood and oxygen in there, it can to some degree begin to repair itself. And once that disc gets bigger, the pain in the back typically reduces. You'll find that the patient stands up straighter and they can walk longer and further.
Oh, that would be such a great relief.
It is to so many people because they finally are in their 60s, 70s, and 80s, and they have the freedom and the financial to do the things they always wanted to do, but their bodies won't allow them.
Oh, yes, yes. I waited to retire all my life, and now I can't do anything. Does it take a lot of treatments to get this kind of result?
Usually, on a typical case, about 5 weeks of treatment. But what I like to do is I want to schedule about an hour and 15 minutes with the patient on their initial exam, and I ask them to bring their spouse because I want to bounce questions off them. I'll ask a lot of questions. I'll feel their spine. We'll review their X-rays and MRIs. Then I can sit down and say, I can help you or I can't. I'm not gonna take up someone's time if I can't help them. They've been through enough at this stage.
But can you help the majority of people?
I would say that the majority of the people come in, we can see relief, a significant relief.
That's fantastic. With lumbar decompression, you can get a leg up on improving your back pain. To find out more, give Dr. Abud a call. His number's coming up next.
To learn more, call the Solon Spine and Wellness Center at 440-941-9331 or visit www.solinbackpain.com. Next, what financial titles entitle you to?